We welcome Dr. O'Day into the studio. How are you this morning, Doctor?
Good morning, CJ. Feeling great.
You're here basically to talk about, HealthQuest. If you live in this area, you know all of the fantastic things that HealthQuest has done in the Hudson Valley over the last few years. Just been an amazing thing for all of us and for all of our healths. But you're here to talk about cardiology, right?
That's correct.
The heart.
That's right.
What keeps us going.
Yeah, you can't live without it.
And I know that a lot of people have a lot of questions about their heart. I know that there's a new partnership between HealthQuest and the Hudson Valley Heart Center, which is located here in Poughkeepsie, right?
Correct. We have actually several different locations all throughout the Hudson Valley.
Okay.
The largest ones are in Poughkeepsie, New Windsor, and up in Rhinebeck.
Okay. And if someone's listening right now, I know, whenever we have an expert on the show, I never try to be an expert. And what is it that you do?
We do several things, CJ. The first is that we obviously take care of cardiovascular disease. Mm-hmm. Someone has a heart attack, an arrhythmia, a blockage in an artery, chest discomfort of any kind, those kind of things. The other things we do are preventive services. So someone who might be relatively young, who had a relative that died young of heart disease, those people we see also, and we try to prevent disease.
Okay, so if someone, is driving to work right now, and I'm not saying, someone that's experiencing chest pains right now, but you should go and get checked at least once a year, right?
I would say about once a year is a good time for someone to get checked. And it really kind of depends on your age. Obviously, we're not talking to the 20-year-olds who are healthy here, although certainly that's the time to start taking care of yourself to avoid things later. But certainly more the middle-aged person who has some risk factors such as smoking, obesity, not exercising, diabetes, and high blood pressure, those kind of things.
Check. And that's why, I know we were talking when we were walking down the hallway. I've actually been to the Hudson Valley Heart Center because I've had, there's been times in my life where I'm trying to be healthier now. And my wife has gone on this whole gluten-free, dairy-free kick. And I've actually dropped like 30 pounds, in the last year. And for me, I feel a ton better, and I've stopped, worrying, not necessarily worrying, but exercise is the key.
It definitely is.
I mean, it's amazing to me how much of a difference it makes. And obviously you recommend that.
Absolutely. And your experience is not unique. It's universal. Everyone feels better after exercise.
That's great. So again, we are doing our Ask the Experts segment. HealthQuest has joined us, and obviously the Hudson Valley Heart Center with locations all across the Hudson Valley. You guys have a website that people can go to find out more about what you guys offer?
Yes, we have a website. It's hvheartcenter.com.
Okay.
And you can go there and find out all about the practice, the doctors, and there's also a place there where you can ask questions.
Yeah, and again, that's why we have Dr. O'Day on the show this morning, and we'll be featuring HealthQuest up on our website all month long. So you guys, if you have questions about the heart and ways to, prevent, because that's really what this is about. It's about preventing heart attacks and strokes and stuff like that. Go to our website, HudsonValleyCountry.com. Click on Ask the Experts. We have a link where whatever questions you have, you'll be able to send directly to Dr. O'Day, and he'll be able to answer them. If someone calls and makes an appointment, would it be, you have more than just you there, right? There's a bunch of doctors?
Absolutely. We have 25 cardiologists, including subspecialists. There are general cardiologists who take care of everything, and then we have people that specialize in heart failure, people that specialize in what we call interventional cardiology, where they actually go in and fix things. We have cardiac electrophysiologists, which are basically electricians.
Okay.
So we have plumbers, we have electricians, and we have general contractors.
You got everything. You're running the gamut. You've got a little something for everybody.
There's two things. There's nature and nurture. Okay. Nature is what you're born with. Those are the genes you're born with. That's grandpa who had a heart attack at a young age. Or grandma, for that matter. And those things can certainly come to haunt you later in life.
Okay.
Then there's nurture. Nurture is what you choose to do with your life. That's the foods you eat, what you drink, whether or not you've done drugs at any time in your life, how much exercise you do, what's your weight. Those are the kind of things that you've chosen to do. And both of them are probably equally important.
Okay. So, and again, if you do have, a history in your family of heart problems, and you do overeat and you do smoke, and you really obviously want to stop those things, but definitely go and check out the Hudson Valley Heart Center. Again, the fine folks from HealthQuest have really taken things up a notch here in the Hudson Valley over the last couple of years. It's amazing to me. There's so many different things that are available to make our lives better.
HealthQuest and the Heart Center are merging, and the reason we're merging is to help people in this area obtain better services. We're looking to add things that are rather capital intensive, such as cardiac MRI and a valve clinic where we can do much less invasive valve surgeries on people that they have to travel a long way for now.
Okay.
So those are the kind of things we're looking to add as services. Also, a robust research program, which we've already started. As a matter of fact, just so you know, CJ, and maybe some of your listeners know, we're going to be doing a research project on weight loss drug and cardiovascular outcomes with this particular weight loss drug.
Really?
That's going to be starting up in the near future, and you'll see some things in the paper about that.
Thank you very much, and I will get in touch with you about that weight loss thing because that actually sounds like a real interesting thing.